like a perfect night to dress up like hipsters and make fun of our exes. It feels like a perfect night for breakfast at midnight.
Hi, I'm Royston Sungong, 49988, as a Parkinson's patient.
Alicia Janana Angga, 49611, will explain about what is Parkinson's disease.
Hi, my name is Norera Munira binti Nordin, 48033. I will explain about the factor of Parkinson's disease.
Sheila binti Muhammad Hamid, 48007, and I will explain about the treatment of Parkinson's disease.
Hi, I'm Lai Wiling, 49752, and I will discuss about the symptom of Parkinson's disease.
We just keep dancing like
What is Parkinson's disease? Parkinson's disease is a movement disorder which it is a condition whose main features are slow movement, tremor, and gait or balance problems. Parkinson's disease is referred to a progressive neurological condition resulting from the degeneration of dopamine-producing neurons in the substantia nigra, which is located within the basal ganglia deep in the lower region of the brain. Parkinson's affect functional activities such as balance, walking, speech, handwriting, typing, driving, and many other routine activities, as they are usually controlled by the mechanism of dopamine and the basal ganglia.
Parkinson's patient having a movement disorder. In this symptom, it's divided into two, which is motor and non-motor symptom. In the motor symptom, as we can see, the patient will having bradykinesia, which is having slower in all movement by having arm stop swinging and walking and leg feel heavy. Besides that, the patient will having hypokinesia, which is having loss of facial impression. The patient also having postural instability, which is having balance problem. And lastly, the patient having tremor symptom, which is having shaking, trembling, quivering movement in all his action.
In environment factor, Parkinson's disease results from combination of nature and nurture, with the interaction between a person's underlying genetic makeup in their life activities and environmental exposures. Some environmental exposure may lower the risk of Parkinson's disease, while others may increase it, while some people have inherited a genetic makeup that makes them more or less susceptible to the effect of toxic or poisonous agents. Others potential risk factors such as age, gender, head injury, area of residence, occupation, pesticide exposure, and exposure to metals. Meanwhile, in genetics factor, there are two categories of genes, which is causal genes and associated genes. Causal genes of genetic is very rare, accounting for perhaps 1 or 2% of people with Parkinson's disease. Second category of genes is associated genes that do not cause Parkinson's by their own, but increase the risk of developing it. In causal genes, a family whose members have the same disease, the individual may have very different experience with the disease, while for associate genes, there is a great variability in mutation that occurs in the gene as well as in their effect.
it seems like one of those nights. This place is too crowded.
As for the treatment, It is important for persons with Parkinson's disease to realize that although the underlying disease progresses slowly, the clinical course over many years varies greatly with each person. A treatment plan consisting of appropriate medication, regular exercise, healthy diet, social engagement, cognitive activities, counseling and therapies, and last, deep brain stimulation.
Too many cool.
As the disease progresses and problems accumulate, DBS surgery may be a reasonable therapeutic optic for some individuals, although many people with Parkinson's disease do not qualify for deep brain stimulation for variety of reasons. However, the majority of people with Parkinson's disease can lead full and active life with a good symptom control for many years. Deep brain stimulation is used for the treatment of movement disorder in Parkinson's disease to cure and prevent this disease to be more bad condition.
Kids.
Hello.
Hi!
Hi.
Thanks for watching. If you want to know more about Parkinson's disease, search more on Google. That's all from us.
Bye.
It's like one of those nights we ditch the whole scene and end up